Hello everyone and welcome back to my channel. If you are seeing my face for the very first time, hi, welcome. But let me know in the comments what made you click, what about this video was like, oh, I want to know what she's talking about. If you are a returner, if this is not your first time seeing my face, hi, what's up, holla. But I remember in my last video, I begged, I asked, I was like, I'm almost at 200 subscribers, and y'all really got me to 200 subscribers. I've been on YouTube for a month, and the love has been amazing. I can't even believe that we've gotten that far, but I'm so grateful for everybody, for all the love, for all the comments, for everything that y'all have shown me, and I hope that we continue to grow like this. Okay. How do I look? How did you like her? I did my hair in some Mickey Mouse puff. I like it. It can look like a small girl. What do you guys think? Yeah, I like it. But let's get to the matter of today. Well, I'm going to talk about clinical experiences, and I think clinical experience is something so important to talk about because a lot of times we don't talk about it. Actually, it's one of the things that is assumed is a given, that you're going to know as somebody who wants to go to medical school, but it's not actually something that a lot of people talk about. How to find, how to get, what counts as clinical experience, all those kind of things. And I want to make it clear that clinical experience is different from shadow. Whenever I talk to a lot of premeds, or even me as a premed, right? So I've said it before, I'm a reapplicant. I applied to medical school before. So this time around, this cycle was my second time applying to medical school. And when I applied to medical school the first time, I did not have any clinical experience. I had zero. Why? Because I thought shadowing was good enough clinical experience. I thought that, physician shadowing, following a physician around, which is important, which you do need to have, but that's not clinical experience. And I remember listening to one of the podcasts with Dr. Gray, where he had an admissions officer around, and they said not having clinical experience is actually one of the biggest reasons that premeds don't get into medical school. And that's because a lot of people think that physician shadowing is clinical experience. No, it's not. So if you are one of those people today, having physician shadowing is not enough. If you do not have any clinical experience, don't apply to medical school yet. You need to have some. They will you will be wasting money. They will throw your application out because they'll be like, this person, how do you know that you want to be a doctor if you've not had contact with patients, if you've not done things that show that you want to be a physician, okay? So today I just want to give some examples of clinical experiences that, especially as international students, that will really, help us to solidify that we want to be physicians, and it will be something that we can talk about on our applications. As international students, we can only really work through either on campus, CPT or OPT. So us getting clinical experience is a little bit more complicated than US students, but there are ways to get it. There are things that we can do that help, that will be able to mitigate the circumstance. The first one I have is being a doula. That was how I got clean. So I'm a doula. I'm a certified doula. And I went that route because I'm very interested in maternal and child health. So I did my master's in public health, in maternal and child health and global health. And so being a doula was just one of the added things I wanted to, learn and be able to do. So being a doula is a very easy way to get clinical experience. So I got my doula certification, and then I was able to work as a doula through a CPT opportunity. And that's because I was doing my maternal and child health. So it worked, you understand? They balanced, if that makes sense. So being a doula is something that a lot of people don't even know that you can do as an international student. So the courses are not that expensive and they're not that long. So, and then you can use your CPT opportunity to work as a doula. You understand? So it's not bad. It's a good opportunity. I'm keying you guys in now. Don't say a girl never did anything for you, okay? Another one, which is CNA. So CNA is Certified Nursing Assistants, okay? So most CNA programs are about 6 weeks long. So it's something that you can, take out a summer and become a CNA. And usually, as long as you have some kind of pre-med related major, you can be a CNA as a CPT opportunity. You can also be a CNA as an OPT opportunity, if you're if you're taking time, it's something that you can do. If you're doing OPT, it's something that you can do, but mostly people do it as a CPT opportunity. So I'll say it's a little bit on the pricey side. I'll put all information about, like how much it costs to become a CNA, but it's not something that, you need to go to school for your extra 2 years or something. You get me? It's usually a 6 to 8 week program. You get certified as a CNA and you can start working as a CNA. It's a good way to get clinical experience opportunity, okay? Another one, which a lot of people do, but this one is a bit tricky, is research. There are certain kinds of research that you can do that do not count as clinical experience. If you're working in research in a lab or all those kind of things, it really doesn't count as clinical experience. Why? Because you are not coming in contact with patients. Like Dr. Gray will always say, like, if you need to be able to smell the patient, you understand? But you're not coming in contact with the patient, so it doesn't really count as clinical experience. However, if you're doing some kind of research, which I actually did research like that, because I did like research in contraception, so I was directly working with like in HIV research and all that kind of stuff with people. So that kind of research does count as clinical experience. So you want to be sure that the research you're doing is direct human contact, like where you're directly working with patients, for it to count as clinical experience. Another one is EMT. So emergency medical technician, I think that's what they are called. So my problem with EMT is that the certification process is really long, and especially as an international student, sometimes like you don't even have that time. But if you're someone who has the time, you understand, maybe like you have the time to dedicate to courses to become an EMT. I think it's about 6 months. It's about 4 to 6 month course to become an EMT, and there are part-time opportunities. And sometimes, depending on your university, some universities offer EMT programs like certification. So if you're at a university like that, take advantage of it. Take that opportunity. It's something you want to do. And then again, I think EMT is something that you can work on a CPT, but it's not something you can work full-time on a CPT. CPT is part-time unless you work it as a summer opportunity CPT. So, but the point is, as an EMT, it is definitely clinical experience. If you want, like, I don't want, is this clinical, is this not? EMT is definitely clinical, but there is the money factor, there is a little bit of the time factor. Then, volunteering at a hospital or at a hospice center. So when I say hospital, I mean like whether it's as an ER volunteer, as labor and delivery volunteer, any kind of volunteering. However, working as a janitor in a hospital is not clinical experience, you guys, okay? So it has to be volunteering where you are, again, directly in contact with the patient. So that kind of thing, like where you're going to the patient's room, you're doing things for the patient. So that's the kind of volunteering. Maybe you're taking hospital transporter. There are just different things like that, that do count as clinical experience. But if what you're doing is changing sheets or not really having any direct contact with the patient, it does not count as clinical experience. So either at a hospice or at a hospital or nursing home, anything like that, there are opportunities to volunteer that do count as clinical experience and as an international student. And volunteering, you don't get paid as a volunteer, right? But you also don't have to pay to be a volunteer. So that's like one of the catches, like it's one of those things that you can really get into quickly. You don't need any, usually it's the hospital or so that will train you. They will give you the training that you need, but you also don't get paid for it. So, but volunteering is a good opportunity. Another one a lot of people do is scribing. But the thing about scribing is usually, I barely ever see part-time scribes. Most of the scribe I see is full-time scribe. So scribing is something I would recommend as an OPT opportunity, not as a CPT opportunity. So scribing, there's a little bit of training, but training is not as long as, I think it's about, a 2 to 3 months training or thereabout. And a lot of time the training, they are paying you as you're being trained. And scribing, you get paid as well to be a medical scribe. So what's a scribe? A scribe, they usually take notes. They help the physicians, NPs, they help them to take notes, patient notes. But the thing about scribing is a lot of time they're not part-time. A lot of time, like, I've not really seen people that were scribes while we were in school. A lot of people that were scribes did it like as in their research year, like, or like after graduation. And then the last one I have is MA, so medical assistants. So depending on the state that you are and depending on like usually the institution, so medical assistants require some places require like full MA training, other places do not. Okay, so there are ways to find out from different places. Oh, do you require me to actually get full MA training? Do you require me to get some MA training? Do you do on the job training? So medical assistant, there are different ways to go about it, but usually there is some kind of training involved, so you would have to pay. Okay, but then you also get paid. It's a paid position, and it's usually something that you can do part-time as CPT or full-time as an OPT opportunity. So with MA, I know people who did MAs at like urgent care centers, at hospitals, at doctors' offices, in private practice. That's a good way to get that relationship. And a lot of times as an MA, you can also shadow the physicians that you work with. So killing two birds with one stone here, okay? So, but these are some of the ones I have. So the reason why I specifically chose these ones are because they are ones that I've seen international students be able to do and get through with. So without, really having much of difficulty. But if there are other ones that you have, if there are other opportunities that you yourself you've done, or if there are other opportunities that you feel like that people have done, let me know in the comments, okay? I want to know. But as usual, thank you guys for watching. Don't forget to like my video, comment, okay? I want to see the things that you people have to say. Then subscribe and share. Let other premeds know, especially international premeds, let them know how to get this clinical experience, because people are literally being rejected because they don't have it. And it's not something that is technically hard to get. It's not even something that they don't want to do. It's just that they don't know that they have to do it, okay? So, but please continue to like, share, subscribe, and all that good stuff. Until next time, bye.